presentation, we are going to learn the parasympathetic nervous system. As in the previous video, you have seen the basic overview of the autonomic nervous system. We are now going to dive deeper into each component of the autonomic nervous system. For this video, we are going to focus on the parasympathetic nervous system. As we have learned before, the parasympathetic nervous system decreases the functions of the target organs, for example, for rest, etc. And we have also learned the basic blueprint of the autonomic nervous system. Please remind yourself, or if you want to, you can go back and watch the previous video of the autonomic nervous system. So without further ado, we can further go into this presentation. As you have seen in the previous slide, the parasympathetic nervous system is also known as the craniosacral nervous system. The reason is that the cell bodies of the preganglionic nerve fibers are located in the brainstem that include the specific cranial nerve nuclei or spinal cord, the terminal portion like the pelvic splanchnic nerves, which are also part of the parasympathetic nervous system. As you can see in this slide, these are the nerves of the parasympathetic nervous system. There are some specific cranial nerves and their nuclei in the brainstem, while there is the terminal portion in the distal portion of the spinal cord. The points of the origin for the preganglionic nerve fiber cell bodies is in the brainstem or in the spinal cord. They will send out the axon outwards to be connected with the cell bodies of the post-ganglionic nerve fibers in the ganglia. Now we are going to see each nerve that is associated with the parasympathetic nervous system. Please remind yourself of the basic blueprint of the autonomic nervous system, the preganglionic nerves and the postganglionic nerves, etc. Please remember, in parasympathetic nervous system, the preganglionic nerve fibers are long and the postganglionic nerve fibers are short, and the ganglia that are associated with it are closer to the target organs. As you can see in the diagram below, there is a cranial nerve 3 or the oculomotor nerve. It synapses with the postganglionic nerve fiber in the ciliary ganglion. Now please remember, there are other nerves that have different functions and they pass through this ganglion, but the cranial nerve 3 is associated with the parasympathetic nervous system, have a synapse here. The next one is the cranial nerve 7 or the facial nerve. It synapses with the two different ganglia. One is the pterygopalatine and the second one is the submandibular ganglia. You can see the two blue arrows in the diagrams below, which are going to point towards the ganglia. The next one is the cranial nerve 9 or the glossopharyngeal nerve. It will synapse with the glossopharyngeal otic ganglia or GOP in the short form and the parotid gland. The next one you can see below is one of the branches of the parasympathetic nervous system is the cranial nerve 10 or the vagus nerve. It has multiple organs that it innervates. It will connect with the organs of the thorax, midgut, and this is important to remember, the proximal portion of the hindgut. You can also see that it supplies the heart, larynx, bronchi, lungs, esophagus, stomach, and array of other organs, etc. The final branch of the parasympathetic nervous system is the pelvic splanchnic nerves, which are made from S2, S3, and S4, and it supplies the distal hindgut and the pelvic viscera. As you can see that it supplies the distal colon, rectum, bladder, and the genital organs. With this slide, we conclude the basic anatomy of the parasympathetic nervous system. In the beginning of the video, I have shared the link for the basic overview of the autonomic nervous system. Please review it. You will also find the link in the description as well. Please like and subscribe. If you have any questions, please feel free to reach out. The next video that we are going to view is the basic anatomy of the sympathetic nervous system. Please see the link in the description below.